Thinking back on that night in particular, it actually seems almost absurd that we talked about the first case in such detail with millions more still to come. You know, in hospitals around the world, we struggled. And to give you an idea of the crater that it's left in many of us, I talked to 4 of my colleagues in the Henry Ford Health System about their thoughts from their first patients through now.
When COVID first arrived, and it was the fear of the unknown, the fear for our families and our friends. We went into this relatively blind. We had never experienced anything like this, and then much less of this magnitude.
Oh, I just remember overwhelming fear and just being terrified, even to just go on to that side of the unit.
During that first wave, the first time we had, I think we had 6 terminal weans all in one day, and our morgue can only hold 5. And we didn't know what to do. And the time that I looked out my office window and saw a refrigerator truck in the back that was to hold the extra bodies, I never will forget that. That really made it real to a lot of us when we saw that.
I can still recall the first patient that I saw in the ICU at that time, and it's something that still doesn't leave my mind because that patient did not end up making it. And, you know, we wrecked our brains thinking, did therapy have anything to do with that? And obviously over time, we learned that it was the disease process, unfortunately.
You know, from patient 1 and being in the room with my first COVID patient and having a mask and gown and gloves and all these things on and not knowing for sure, you know, how sick this patient was going to end up being or how sick I could be if I wound up contracting this. That was a very high level of anxiety. It was just a constant stressor of figuring out all these unknowns and dimensions that we hadn't even had to really, frankly, consider with anything else we've faced before.
I had one patient that this was during the first wave, we worked so hard all night long just to get him through to the morning so that his wife could say goodbye via an iPad while we held his hand.
In that first wave, several people did develop COVID. But to their credit, as soon as they were healthy and felt well enough, they returned and they jumped right back in to help their brothers and sisters in arms, because that's what it was during that time.
Even when it was very dark back in 2020, the sense of just being together and united with the community, but also other healthcare providers of, you know what, we've got this and that will move forward.
I will say one good thing that COVID kind of did is that it brought all of myself and all my coworkers together.
I think that also was part of our satisfaction in this, is that this is what we signed up to do.
Now, everyone hopes we're going to be entering a calmer period, but of course, no one knows for sure. Either way, 2 years later, we all feel more prepared to handle whatever comes our way. Back to you.